Hi everyone, another update. As far as the cancer goes, there's not really much to tell. I had the MRI, results came back from that, which basically just says, about the one area that the gynecologist had found and biopsied. And then there's also a lymph node, which I think is the same one that they biopsied back in November, that had showed, sorry about that, had shown negative, and it's now showing metastasis. I still don't have any updates. I have to wait until the urology tumor board meets, which isn't until April 14th. So I still have another 2 weeks of waiting and wondering. This, along with just life in general, really kind of kicked my butt, and I ended up taking off some time from work to kind of deal with the emotional aspect of everything. I was having the cats are trying to kill each other. I was having panic attacks at work, crying spells, really having difficulty with working with certain patients if they had a history of cancer. It just was tough for me to hear them telling their stories and knowing my own, and just feeling overwhelmed by all of it. We have been short-staffed for the better part of the last year because of COVID. We lost a lot of staff. We did have a couple people who finished nursing school and moved on because of that. People who left for personal reasons. Really, the whole hospital has been low on tech staffing. And we've had a lot of nights where whoever's working ends up being the sole tech on the floor, which it's just too much. Our census is typically a full 30 patient load, and most of the nurses help out, but it's still overwhelming. There might be 5 or 6 nurses on, and your phone's blowing up, and they're all calling you at the same time for different things, and you can't be in 5 places at once and still trying to do all your regular tasks. So it was just really overwhelming me. And I was feeling a lot of physical pain too. My back, my feet, my ankles. If I worked 2 nights in a row, I would come home just wiped by the end of the second shift. And it would take, a good solid day to 2 days for my feet to feel like I could even, walk up the stairs without wincing in pain. And I know probably a lot of that is weight related. And of course, my hopeful weight loss journey through the bariatric surgery program ended up being put on hold because of the cancer situation. So I'm trying very hard right now to just be very conscious and mindful of what I'm eating. When my depression gets the worst of me, I tend to be a stress eater and very emotional eater, and I will just eat junk, whatever I can get to quickly and easily, and eat way too much of it. So that hasn't been necessarily helping my physical well-being. I'm not sure why my screen is like fading from like bluish to red. I'm in my room and I just have my small bedside table light on, which made my phone go into night mode or whatever it's called. So I think it's got something to do with that. But anyway, so I ended up getting an appointment. Well, I talked to my psychiatrist, and we made a med adjustment, which ended up being really, really beneficial. Made a huge difference. I basically spent 2 weeks sitting around doing nothing but eating, sleeping, watching TV. I had no ambition to do anything. The house has just been very cluttered. I think everybody probably has that area in their home that becomes kind of the catch-all for whatever. The two big areas for us were the living room coffee table and the dining room table, and they were just covered with mail and boxes and packages and just things that just ended up there. In passing by, they just got set down there. So with the med adjustment, it didn't really seem to be doing anything right off the bat, which is not unusual for depression, antidepressants. It takes a little bit for them to really kick in and start working. So this past weekend, Saturday morning, I got up and I actually felt kind of goal oriented and ambitious and motivated. And Brian and I, throughout the weekend, did a lot of cleaning, dusting, which is my least favorite chore. Clearing off those cluttered areas, vacuuming, getting rid of empty boxes, things like that just had been adding up over the months. I think a lot of people throughout COVID and throughout the quarantine and everything, I think people had a tendency to do a lot of housekeeping and things to try to keep from being completely bored. I didn't really have that. I don't necessarily want to call it a luxury, but I didn't have the opportunity to do that because I was still working throughout all of COVID and going to school through most of last year. And, so things just really got away from me. Brian has been extremely helpful as far as taking care of all the stuff that needs to be taken care of. He would make sure that we had dinner on the table, dishes washed, laundry done, make sure that I had clean scrubs and food before I had to go to work. Taking care of the cats and feeding them and supporting me through all of the junk I've been dealing with. So, between the two of us, we were pretty wiped out as far as maintaining the house. So we've both had spent this weekend doing a lot and getting a lot straightened up, cleaned up. I still have things in my office area that are still packed in boxes from when we moved in. That's kind of the least of my worries at this point. But the areas that really needed to be taken care of have been taken care of. So I think the change in the antidepressant is really making a difference, which is I'm very grateful for, because it's been tough. It's been tough to be motivated and do the things I need to do. I'm hoping I'm supposed to go back to work next week. So I'm hoping that I can kind of get some coping skills under my belt to deal with work and be able, I've tried I've tried over the last few months with being so short staffed. I know that one person can't do everything, and I've tried to advocate for myself and say, like, no, I'm not able to do what you're asking me to do. When I have 10 other things that need to get done. And sometimes I feel like I'm being met with some frustration on the part of the nurses. I don't know if the other techs feel that as well, but I definitely do, and it might be because my emotions have been a mess, that I'm feeling that way. So I'm hoping that when I go back, I can kind of deal with all that. I did have this afternoon. I had an appointment with a therapist from the EAP through the hospital. It's, if anybody's not familiar, that's employee assistance program, and they provide support. You get X amount of appointments per year, and they provide support and referrals if you need to further seek further help. I do have a therapist, but she's been so backed up with COVID and other people experiencing depression that she won't have anything available until like the end of April, which I'm sure I'll need her at that point as well. But I really needed to kind of get some things out now and start learning how to better deal with them. You'd think with all my years of therapy that I'd be really good at this, and my years of doing psych rehab and teaching other people coping skills, but it's really hard to apply it to yourself. Oh my god, I didn't think I was going to get this emotional, but one of the things that the therapist told me was that I am not the first tech that he has worked with who has expressed these frustrations with the staffing issues. They've got to start getting some people in, because we can't do it. We can't do it all. And if you work in healthcare, you're typically there because you want to help people. And when you just don't have the resources to do that, and those resources being people, being help, it's frustrating. And then knowing that you're going to have patients who are complaining that they're not getting what they need, it's because we just can't do it all. So yeah, there's all that. Um, I had a bunch of other stuff that I was going to talk about, but I'm already up to 15 minutes on this video. And, oh, I know what I was going to talk about with the motivation piece. When I started kind of feeling more, more able to kind of function and get some things done. One of the things that I noticed is that you can probably tell just from my kind of train of thought with this is that I'm still experiencing a lot of my head spinning, a lot of racing thoughts, and things being really jumbled that I can't make a lot of sense out of them. Um, I should say that. Not that I can't make sense, I just can't organize them. When I was cleaning over the weekend, I was doing, 10 minutes in one area and then walking past another area and thinking, oh, I need to do that. And then I would jump to doing that and then go back to the other area and then pick up three more areas to start working on in the meantime. So my thought process and just my mind itself is still very, very disorganized, very jumbled, um, very forgetful. And these are all normal, normal things that you experience with depression and anxiety. Um, but it's frustrating and it tends to kind of increase that depression and frustration and all the other crappy feelings that you're feeling. So, I'm getting ridiculously emotional and I'm getting ready to go to sleep, which means I need to put my CPAP on, which means I need to get all of this snot that's building up in my sinuses cleared out so that I can breathe through my nose. Um, Good times, good times. Um, so, uh, I guess that's it for now. And once I know more about how the cancer is going to be handled, I'll do another update video and let you know what they're going to do. And it's most likely going to be surgery, but the last update that I had was from the PA at the urology office, who basically she'd talked to the doctor, to the surgeon, and he is the surgeon is the chief of urology, so he is incredibly busy, um, and so he everything ends up going through the PAs. Like even when I had my initial appointment about the surgery, it was with a PA, which kind of sucks. I'd rather hear things right from the horse's mouth, basically, but I do trust the PAs that work in his office. But anyway, he had told the PA to pass on to me that he most likely thinks that it's going to be a surgical. This will be surgical, and that he is working on organizing a team to do the surgery. I don't know what all that entails. I mean, obviously, anesthesiologists, nurses. I don't know who all ends up being in the OR during a surgery, but yeah. So he's working on that, and that's probably what the eventual plan will be. But they do need to run it past the tumor board, I guess, to find out if I'm going to need additional treatment, chemo, radiation, whatever else. How they're going to, monitor going forward with scans and things, and what the risk factors are with it spreading somewhere else. That's probably my biggest fear, is that it'll end up in another organ somewhere, and metastasized there, and that won't be able to be treated. So that's really scary. Anyway, I need to get it together and try to get some sleep. So I'll update when I can. And there's that. Alright, good night.